Lancet Countdown has released a report on climate change and health with some important message to COP26, which is taking place here in Glasgow. So, what is the key message of Lancet Countdown that you want to give to government here in the COP26?
That's right. We just published our 2021 report, whose title is Code Red for a Healthy Future. And that is the main message that comes from our report. In every one of the indicators that we track, and we've been tracking these indicators for 5 years now, we see that they're all flashing red. All of the domains of climate change impacts on health are getting worse across all of the different aspects that we're tracking. The exposure to extreme heat, increased incidence of extreme events, exposure to infectious diseases, reduction of the crop yield potential, increased exposure to wildfires, etc., etc. And one of the most important things that we see is that it is the most vulnerable in every country that are being exposed the most to these health hazards. But that if we act it now, that transition towards a low carbon economy, sustainable system would be really beneficial to our health through the so-called health co-benefits of the low carbon transition. However, as we start to recover from COVID-19, governments are unrolling trillions literally of dollars towards COVID recovery plans, and so far we don't see those COVID recovery plans aligning with the Paris Agreement and a low carbon transition that could be good for health. So it's a really great opportunity that politicians have today at COP26 in ensuring that as we come out of the COVID crisis, we don't walk into the climate crisis for health, and that we deliver a healthy future today at COP with everyone acting together to leave no one behind.
And recently, you co-authored also a crucial report of the Italian National Institute of Health on consequences of climate change on public health in Italy. Which are these impacts, and can you say that Italy is a vulnerable country also from a climate change point of view?
Yes, that's right. The Istituto Superiore di Sanità has done this amazing report leveraging on the wealth of data and the research capacity that you have in Italy, and we also contributed with some of our Lancet Countdown indicators for Italy. And Italy, while it's a high-income country, it's geographically very vulnerable, and it also has a very vulnerable population. You have a very rapidly aging population, very elderly population, and that is the age group that is particularly at risk from extreme heat exposure. And this year you just saw what happened in Sicily that hits almost 50 degrees of temperature, and that's putting the most vulnerable sector of your society at acute risk from climate change. It's also a country that has risk to drinking water, and with the climate change we're also seeing changing the rainfall patterns. We're seeing increasing the incidence of droughts and rising sea levels, putting all of your coastal communities also at extreme risk. And we were discussing just now as well mental health. Mental health is crucial in taking into account the impacts of climate change that are not only physical, but also through the extreme weather events, exposure to extreme weather events, exposure to extremes of heat is also leading to adverse impacts on mental health of people around the world. And eco-anxiety is becoming more and more obvious, more and more evident, particularly in the young population. And as they say, the best antidote to eco-anxiety is actually climate action. So it's also a moment to start doing something about this, really.
Co-benefits is one of the most important concepts of this document. Can you explain what are these co-benefits and how they can help us in the climate change challenge?
Yes, absolutely. So if you go to your medic and you ask them, what can I do to improve my health? They will probably tell you just 3 things. Eat better diets, reduce your consumption of red meat and saturated fats, have a more active lifestyle, try to do more physical activity, don't sit all day, don't go everywhere with your car, and reduce your exposure to environmental toxics, particularly air pollution that is very, very harmful. And when we look at what we need to be doing in order to tackle climate change, all of the actions that we talk about actually would deliver also those health benefits. In order to reduce climate change and to mitigate and avoid this getting so much worse, we need to reduce the burning of fossil fuels, and that comes accompanied with reduced exposure of air pollutants, particularly the PM 2.5, those really harmful small air particles that lead to cardiovascular disease, renal disease, heart disease, brain disease, neurological impacts. We also call for reduction of excessive red meat consumption. Ruminants release enormous amounts of methane, and the agricultural sector is one of the main contributors to climate change. So if we shifted towards more plant-based, more healthy diets, that would also have an enormous dividend in terms of reduction of greenhouse gas emissions. And when we look at urban design, if we promote active travel, if we reduce the use of fossil fuels for road travel, if we promote the more green space in urban environments that can absorb carbon dioxide and reduce air pollution as well, that will give an enormous dividend, not only towards the climate crisis, but also in giving us more livable, more healthy cities and more active lifestyles. So you have a win-win scenario in which climate actions actually deliver huge benefits to health immediately.
Yesterday, World Health Organization repeated that health can be put at the very center of the climate conversation. Yet my impression is that people and governments are not yet convinced on that. What do you suggest to convince them, and what is still missing also in terms of research?
In terms of research, there's a lot missing. Research on climate change and health has been very, very limited throughout many years. We now start seeing some funding agencies starting to prioritize and notice that climate change is a health crisis and that we need to have more research for climate change and health. But being able to attribute the health risks and the health impacts that we're currently seeing to climate change is still a big challenge, and there's a lot that the scientific community still has to do, bringing together the tools that we already have in order to answer these questions of what does this mean for health, but also assessing the health impacts of climate interventions to identify which ones are the most effective at delivering these health co-benefits and health dividends. So that's kind of from the research sphere. But it's very important to notice that it's not that we don't have evidence. We do have evidence, and we know that climate change is already affecting our health, and we know that action against climate change would be incredibly beneficial for our health. So it's incredibly important that the health professionals, in acknowledging that the climate crisis is a health crisis, come together and start delivering this message to their patients, in caring for their patients, bringing awareness of how they need to transition to a healthier, low-carbon lifestyle, and also getting involved with the politicians, with policymakers, in ensuring that this transition happens promptly to protect people and their health from climate change, and also in being embedded in decision making, such that when we leave the COVID crisis, we don't walk into a climate change and health crisis, but rather deliver a healthier society for all. And there's an enormous opportunity that we're having at COP within the next 3 days. This will be taking shape, and we're hoping that politicians will respond to the requests from the people around the world to protect present and future generations and their health from climate change.
We hope so. Thank you very much, Marina.
Thank you.